13 News Now is your back-to-school station. While we've heard a lot about the COVID-19 vaccine, there are new requirements when it comes to what shots your kids need to head back to school. Allie Weatherton breaks it down for us.
It's crunch time at Children's Hospital of the King's Daughters.
We've got to get kids ready. We've got to make sure they can hear, we make sure they can see, make sure they're growing well.
But before students head back to school, they need to get certain vaccines. This year, there are new requirements when it comes to what shots are needed.
Our state legislature enacted legislation that took effect July 1st this year.
Pediatrician Dr. Douglas Mitchell is the medical director of CHKD's medical group. He says the new legislation aligns the back-to-school vaccines with CDC's Advisory Committee on Immunization Practices.
Kids entering kindergarten must have the 2 doses of hepatitis A. That is a new change at the state level, not a new recommendation.
2 doses of the chickenpox vaccine are required for students heading into kindergarten. Upcoming 7th graders also need to roll up their sleeves for extra shots.
The meningitis vaccine and the HPV or human papillomavirus vaccine before they enter 7th grade.
And before students head into their senior year, they'll need to get a dose of the meningitis vaccine.
If they do not receive those by the time they enter school, then school nurses will be looking at those records and sending them back to the pediatrician to get the vaccines.
But what about the COVID-19 shot? Dr. Mitchell says the Pfizer vaccine is approved for children 12 and older and recommends students get it.
We're not at a point where school divisions or the state are going to require it for this year.
Dr. Mitchell says it's crucial to make an appointment to get your children's back-to-school vaccines as soon as possible. Allie Weatherton, 13 News Now.
Another vaccine needed is 2 or 3 properly spaced doses of the rotavirus vaccine. It's for children up to 8 months of age.